group therapy, and the biomedical approach. So, group and family therapies. Group therapy saves money and time, though it does not provide the same one on one attention. So, one special type is family therapy. It assumes that no person is an island and that we live and grow in relation to others, especially our families. Therapists work with family members to heal relationships and mobilize family resources. So if you're going to family therapy, obviously you have to work together as a group, to get along, and something's going on within that, group, that relationship that's not happening. So it works on, so you're going to work on working together for that. So does therapy actually work? In 1952, Hans Eysenck shook the psychology world by releasing a study that suggested two-thirds of all people with non-psychotic problems recovered within 2 years of the onset, if the onset of the problem, whether they got therapy or not. So he was saying two-thirds of people, they naturally would recover whether they got therapy or not. So therefore saying we don't really need therapy, we can get over it on our own. So essentially he was arguing that therapy was worthless and no better than having no treatment at all. So the response to Einstein. So as you can imagine, this set off a firestorm of studies on the subject. So psychologists were like, that's not true, that can't be true. We'll prove it. So there was over 375 studies of research that supports two major conclusions. Number one, therapy is more effective than non-therapy. Number two, Einstein overestimated the improvement rate in no therapy control groups. So some basic counseling skills to have during therapy, especially these group sessions. So active listening, right? We've heard that a lot. You need to be a good active listener. You need to echo, restate, seek clarification of what the person expresses. So you need to clarify the problem. If you don't know exactly what the problem is, it's going to be hard to solve the problem. Focus on feelings. Try to avoid giving advice and accept the client's frame of reference. You need to reflect thoughts and feelings. Silence. Know when to use it. Some people hate silence and they always try to fill it in. Well, sometimes silence is good. It puts it back on the client to kind of figure out what's going on. Sometimes they just want the therapist to tell them what the answer is, and that doesn't always work. So sometimes silence can be a good thing. Questions, right? Usually open-ended questions, or closed type questions, which could be yes or no. Both work. Obviously, maintaining confidentiality is of the utmost importance. And then creating an environment that embraces unconditional positive regard. That word that we've heard a few times, right? A caring, accepting, non-judgmental attitude where individuals may begin to accept their worst traits. So the biomedical approach. Biomedical therapies seek to treat psychological disorders by changing the brain's chemistry with drugs. Right? So, you know, you have some type of chemical imbalance. It's all about, balancing that out. Or we could also be talking about surgeries as well, right? You can change the brain, and therefore the way you think by surgery. Or electricity or magnetic field. So shock therapy would also be a biomedical approach. So drug therapy, psychopharmacology. So the first psychological drugs were administered in 1953 with the antipsychotic drugs. So in 1955, over 500,000 Americans were living in mental institutions, each staying an average of a few years. Then, with introduction of tranquilizers, the number declined. By 1965, the number of patients was down to 250,000, with most patients staying for only a few months. So you think about, you get these drugs that allow people to, in a lot of cases, calm down and not show outwardly as much symptoms as they did, so they wouldn't have to be in the hospital. But one, that means that someone had to give them the medication. If they weren't given the medication, then these symptoms came back. So you have less people in hospitals, so a lot of hospitals start to close down. But what happens is the homeless population increases because you have less mental hospitals, and even people who did have some medications didn't always stay on the medications. And when they were on the medications, they could not hold jobs sometimes, right? Or, maybe they would get in fights with their families, and so their families might kick them out. They had no place to stay, and the homeless population really increased because of this. So antipsychotic drugs are used to treat the symptoms of psychosis, which is delusions, right? Believing something happened that never happened. Hallucinations, so that's, sensory experiences, um, false sensory experiences, so like seeing and hearing things that aren't really there. Social withdrawal and agitation. So most work by reducing the activity of the neurotransmitter dopamine. Although the exact reason why this has an antipsychotic effect, these drugs have proven to be quite effective. So what's the positive and negatives of antipsychotic drugs? So while these drugs reduce the overall brain activity, they do not put the patient in a trance. Instead, they simply reduce the positive symptoms of psychosis. Unfortunately, long-term use can cause problems like I not I always mess up saying this, tardive dyskinesia, which produces an uncontrollable disturbance of motor control, especially in the facial muscles. So we talked about, using medication, and it should be a short-term, not a long-term remedy. So often researchers now simply characterize symptoms of schizophrenia into positive and negative categories. So positive symptoms refers to an active process such as delusions and hallucinations, while negative symptoms refer to passive processes like social withdrawal. Antidepressant drugs. So there are three major classes of antidepressant drugs, and all three work by turning up the volume on messages transmitted over certain brain pathways, especially those using norepinephrine and serotonin. The major downside of these drugs is that it often takes a few weeks for them to have an effect. In some cases, time is not a luxury a mentally ill patient has. And that's one of the reasons why they would go into a mental hospital, and a lot of times maybe it's temporary until the drugs take effect. Anti-anxiety drugs. Anti-anxiety drugs most commonly fall into two categories: barbiturates and benzodiazepines. Barbiturates act as a central nervous system depressant, so they have a relaxing effect. So those are like tranquilizers. The benzodiazepines work by increasing the activity of certain neurotransmitters. Then we have stimulants. Stimulants is a broad category that includes everything from caffeine to nicotine to amphetamines to cocaine. They are any drugs that produce excitement or hyperactivity, as we talked about during the consciousness unit. So these drugs are prescribed for a variety of disorders, including narcolepsy and ADHD. There's also mood stabilizing medications. So one is lithium, which is commonly used for bipolar. So this can affect mood stabilizers for individuals suffering the emotional highs and lows of a bipolar disorder. 7 in 10 people with bipolar disorder benefit from a long-term daily dose of lithium, and the risk of suicide is 1/6 of those who do not take lithium. So what's some of the truths about drugs? Cannot cure any mental illness. So a lot of people think it can cure you, but it doesn't do that. What it does, it alters the brain to suppress some of the symptoms. So, you don't show the symptoms, doesn't mean you're necessarily cured though. They can always come back. Can have negative long-term effects, right? That's why we always say, drugs, medications are hopefully a short-term, usage. Depending on which drugs, they can be habit forming, and a lot of times they're often over prescribed. There's also psychosurgery. Psychosurgery is a general term given for any surgical intervention in the brain to treat a psychological disorder. These surgeries were far more common in the past and today have become a method of last resort. So lobotomy, a lot of people have heard of, is a type of operation where the nerves connecting the frontal lobes to the emotion controlling centers in the inner brain were cut, right? So we know the amygdala is the emotional center. So they would actually cut these and there would be a disconnect. So nowadays we have we have medications and other surgeries that are a lot less invasive. And lastly, there's brain stimulation therapies. So we have electroconvulsive therapy, ECT, which is a treatment used primarily for depression that involves the application of electric current to the head, reducing a generalized seizure. The ones nowadays are a lot less invasive than the ones from the past. If you have seen some videos of it, they were very they looked a little disturbing. We also have nowadays TMS, transcranial magnetic stimulation, which is a treatment that involves magnetic stimulation of specific regions of the brain. But unlike ECT, it does not produce a seizure.